Politician takes the time to come to a forum like this, you ought to take the time to find out who that politician is, whether they're in your district, and whether you should be supported. We have two here tonight who have come to this forum to hear us out on single payer, and we're glad to have them here. And one is Mark Rosie. You want to stand up, Mark? He's running in the 126th district. If you're in that district, you want to walk over and talk to him. Thank you. And Joe Haas, I don't know if he's still here. What district, Joe?
187, so Kutztown itself.
Okay. If you live in Berks County and someone says to you, Ron and Rosie, you know who that is. I may fight with Ron and Rosie and argue with Ron and Rosie, but one thing there's no fight about, and that's their commitment to single-payer health insurance. They have been veritable crusaders ever since I've ever known them, and never wavered in their support for this really important social issue. You're going to hear right now from one half of the dynamic duo, Rosie Skomitz.
What Dave just asked you to do is what my message is going to be as well, and that is that we need all of you to help push this movement forward. So thank you for being here. Thank you so much to Chuck Brown and the wonderful people at St. Barnabas for hosting this event tonight and pushing this movement forward. If you have not already done so, we have clipboards here which we'd like to get your contact information, because we would like you to be part of our email alert network, and also start to receive our newsletter. Healthcare for All PA has a newsletter that was alluded to earlier, and we want all of you to get that. And that way, anything that we need you to do to help this movement along, you will be hearing from us. And it's a wonderful way for you to stay in contact with our organization. So please, if you haven't already done so, please make sure that you do sign our clipboards for your contact information. Also, this event is being taped and DVDs will be available. So I would ask you, if you would like to have us show this DVD at your group, your club, your organization, we will be happy to do so. In the reception room in the back, there's a table that has some information, literature about this, this legislation, and also our cards where you will find out how you can contact us to be in touch and to get these DVDs out there to all the groups in Berks County that we can reach, to do just as Dave said, to make sure that we're the ones screaming out that to have our legislators pass this legislation. So that's one thing I would really like for you to do. Contribution envelopes are also available. Please avail yourself of those. And make a habit of checking the Healthcare for All PA website to find out what the latest is. But if you sign up for the newsletters, you'll be in good shape there. Also, I want you, and this is a little plug for commonsense2.com. Please read commonsense2.com. Every month an issue comes out. And Ron and I have a column called To Your Health. And we write generally, of course, mostly about the single-payer solution and how the movement is coming along and some of the things that are wrong with our current system. So please do all of those things. You need to be part of this movement. It doesn't happen without you. And thank you all once again for coming tonight.
Okay, we have a YouTube cable, the amount of time cable wants us to have this done in. We have about a half hour that we can give to questions before we start our part. Please, when you ask your question, I know sometimes to ask a question you need to set it up, but please keep in mind other people want to ask questions, so set it up as shortly as possible, and if there's a follow-up, make it a one-sentence follow-up. Okay, I'm going to be coming around now. Come on up, guys. Is this working? Okay.
Yes, I have a question about the positions. I understand, I might be wrong, and maybe you can help me out with this. The American Medical Association, I believe, is against single payer. It's my understanding, though, that the percentage of physicians in this country who belong to the American Medical Association is a minority, much smaller than people understand, but they have a very strong lobby. What about the physicians who are not members of the AMA? How do they feel about single payer, and what can we do to help get physicians on board to back this?
I think that there is a parallel organization called Physicians for a National Health Program, PNHP. They are thousands of physicians who support the universal single payer, and people do call this by other names, but they support that solution. You need to talk to your doctors and say, are you a member of PNHP? Make sure that they are, and supporting members of it. I think you will find, and this is not universally true, but I think you will find that the general practitioners, the family practice doctors, and some specialists tend to be more favorable to single payer. It's the upper echelon, if you want to call it that way, the real specialists, the neurosurgeons, and those who are in very narrow healthcare fields who are probably not supportive at this time of single payer. But as far as I'm concerned, if they're not supportive, that's an opportunity for us.
Yeah, I can expand just a little bit on the AMA. The membership of AMA represents about 15%, but they don't speak even for their membership as a whole. The other thing is that the most recent poll that was done last year among doctors across the country found that 59% support the single payer solution. And that's something we would not have found a decade ago. And these conversations are really picking up steam. Doctors are extremely frustrated with the administrative costs, with the hassle, with some mysterious person in the background meddling in the decision, as Dave alluded to, between the patient and the provider. So, yeah, you're absolutely right.
Would complications arise if there was a car accident and some of the people were in-state residents and some were out of Pennsylvania state residents, in terms of their health care being paid for if they were in serious condition?
The way our legislation is written, if you are a Pennsylvania resident, you would be covered for healthcare costs anywhere, whether you're in-state, out-of-state, even in a foreign country. Now, there are provisions in the bill as to how that happens, but anyone who is out of state, who lives out of state, pays taxes in another state, would not be covered under our Pennsylvania healthcare plan.
Which is another reason why other states are going to follow suit. You'll see.
Two quick things. One, Vermont passed single payer. Is that not true?
No, it's not true. What they've done is they've created a pathway towards single payer, ultimately. But it's not a foregone conclusion. They're arguably on their way, but they're pursuing three paths toward healthcare reform. The most popular, the most universally supported, including the governor of Vermont, are on board with single payer. But it's not yet come to fruition. So, no, it's not yet.
Oh, I thought they did, except that they were going to have problems with the federal government blocking them. I thought that was right.
Well, A couple of things. One, what Chuck has explained is correct, that it is a pathway to it. They passed a bill to develop a Vermont healthcare system. What that system is going to be, we don't know yet, because it isn't done. The details of it, and you've all sort of the devil is in the details. They don't have the details yet. They're still working on that. So it's not single payer yet. The problem with the federal government are two problems. One is the ERISA. That's a problem for us, but the bigger problem is the Affordable Care Act does not allow states to innovate in healthcare systems until 2017.
The other thing has to do with, my daughter is a physician assistant, and she said, as it is, she's very, very busy. When all those new people are put on the roles, who's going to take care of her? Is there training in the healthcare bill? Is there, I've heard, I haven't read 2,000 pages, which is the most ridiculous thing I've ever heard, but the Obamacare bill does not have training for doctors. It has IRS agents that they're going to hire, but no doctors. So how are they, how about the single payer? How does that take care of the training new doctors?
Well, one of the strongest supporters of the proven single payer solution in Pennsylvania are the American Medical Association chapter, the Pennsylvania chapter. One of the beautiful things about Pennsylvania is that we're 4% of the nation's population, and yet here in Pennsylvania we train 17% of the physicians, which means that the attraction among training, or physicians in training, the attraction toward single payer, which eliminates the administrative overhead and the nightmares associated with practicing medicine, will be a draw for those folks to stay in the state. Currently, we are experiencing a major brain drain. The vast majority of those students are leaving the state because of the administrative headaches associated with healthcare delivery in Pennsylvania. But single payer will be a magnet, it will be a draw to retain the students here in the state of Pennsylvania. Again, we train a number out of proportion to our population. Moreover, doctors from around the country are going to try to come and relocate to the state of Pennsylvania. That's not going to be a problem. What many people are doing is they're looking at what happened in Massachusetts, which was the model for Obamacare. And in Massachusetts, which is what I think you're talking about, Dorothy, is there was an explosion in individuals who then needed doctors, and they couldn't find primary care physicians. That's not going to be a problem here in Pennsylvania because of the benefits that accrue to the single payer solution.
John, did you want to speak to that, John?
Yes, I can address part of that. As a lot of you know, I'm on the board Planned Parenthood Association of Pennsylvania. We've clinics all over the state. We're already gearing up for the effect of Obamacare. And the Affordable Care Act has provisions that they've been rolling out now for over a year, giving grants to medical providers to expand their facilities, their staffs, things like that, to anticipate this problem once the people under Obamacare start getting coverage. Community clinics are being funded and created and expanded, getting a lot of grants. And organizations like ours have been getting grants from the federal government through Obamacare to expand our availability to deliver health care. And this is happening to every provider.
I have financing questions. You had said 3%. How would that be collected?
It would be collected as part of your tax return at the end of the year.
So
Now, yeah, the state would collect it. Now, the state would, I would expect, and that isn't in the bill at the moment, but I would expect that where your employer is currently deducting 3.07% income tax, they would deduct 6.07% income tax.
So what if you're not working?
If you're not working, there's still 3%, but it's 3% of whatever income you might have. And by the way, Our bill does provide for 3% for all income, whether it's unemployment compensation, cash benefits, welfare cash benefits, disability income, all income. And that would be collected when you file your tax return, because our bill makes you eligible for the healthcare system when you file a tax return. You must file a tax return, even if there are no taxes due. You file a tax return, and that puts you into the system.
Okay, that's what I was going to say. So you're going to have to come up with the money at tax time. Are there any co-pays at all?
Not provided for in this bill. No co-pays, no deductions.
No premiums,
I
no
mean,
tax.
because even small co-pays would add to the
And
pot.
I will tell you that within our own organization, and Chuck mentioned that there's other states working on it. Actually, there are 26 states that are at one stage or another in developing this. It's a huge discussion among those states as to should there be some co-pay? Should everyone have a little skin in the game on that thing? Even if it's $5. Should there be? Right now, we have no co-pays and no deductibles. Doesn't mean
Another question about children. The adults pay the 3%. So children are just fall under the family, or
they fall in the family.
They're citizens, and that's their
They're
citizens.
citizens.
Right.
Just a question from me before I go on to that, what about things like eyeglasses, mental? A lot of policies today don't cover mental problem, mental health. How does single payer cover that?
Include.
I was just gonna say, hearing aids, all that's 100% covered. Medical, health, we're 50% now, by private companies. We cover 100%. And we cover vision, and, hearing aids are a big thing.
Dental?
Dental, including.
Dental, very good, thank you, John.
Hi, as a self-employed individual, I understand the true cost of healthcare. I pay close to $300 a month for a $5,000 deductible. So things like tests and things like that are unaffordable at the time. My question is, as a self-employed person, how will it affect me? Am I paying the 3%? How many individuals determine something's a business?
All right. The simple answer to that is that if you file a federal Schedule C, and that's how you report your income, then you are reporting as an individual and you pay the 3%. If you are incorporated in either a C corporation, an S corporation, a partnership, an LLC, you pay the 10%.
Let's just say it's a 13% in the scenario that Dave paints. The reality is you get health care, and you don't have to make those out-of-pocket related decisions that keep you from getting the health care that you need. And that's one of the major components of the reasons that we have this legislation drawn the way that we do, is everybody needs to pay their fair share, and everybody gets to have health care that they need. And there will be debate. The numbers probably won't end up shaking out the way that they do. But I want to make sure that we underscore some other economic benefits that build on what Dave is talking about. And that is, and I think this gets to Dorothy's point, is that this legislation will retain doctors and nurses in the state who are otherwise fleeing. It will give reason and pause for those young doctors that we're training in the state of Pennsylvania to stay in the state of Pennsylvania. Our community hospitals, which are disappearing at an alarming rate, as well as birthing centers in hospitals, they will remain open. Businesses will now see a competitive advantage and the ability to compete globally. I know that Dave does his business is globally competitive. That will put his business and other businesses in Pennsylvania on an even par with other international businesses that they're competing with. Because remember, they pay their fair share to their national governments and they get health care, and that's no longer an issue. In addition, and here's one that really needs to be underscored, jobs, 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 right? This is what you hear about from Romney and Obama constantly. Jobs, jobs, jobs. The reality is that there's going to be an explosion in new jobs, picking up approximately a third of the population that does not seek regular health care, especially dental care. Those folks are going to be employed here in the state of Pennsylvania. You're going to see a dramatic expansion of our tax base. so that it's going to be a boon to Pennsylvania economy. It's important to understand that our healthcare bill is not just about healthcare. It's about making life more livable here in the state of Pennsylvania and more attractive, and that's why I believe that other states are going to quickly follow suit.
Here we have 100 million people out of 300 million people, approximately 220, that have no dental insurance. This bill would cover dentistry